and it is a study on the current situation in federal prisons in relation to Correctional Services Canada. I apologize for cutting the witnesses short last time, and it looks like we might cut the witnesses short this time. As you can see, we're waiting for votes, and I may ask indulgence of colleagues to gain as much time as possible out of this portion of the meeting. With that, we're going to turn to Ms. Stubbs for 6 minutes.
Thank you, Mr. Chair. And yeah, I hope we'll be able to hear more from all of the witnesses. The testimony last meeting was very compelling and in some cases extremely troubling and disturbing. Now, I just note that Jeff Wilkins, the head of the Union for Correctional Officers, didn't get any opportunity to answer any questions last time. So I'm just going to focus some questions for him in my time and hope that everybody else will also be able to speak during this meeting. So Mr. Wilkins, I'm just wondering if you wanted to explain for us laymen and for Canadians who might be watching, what are the differences between solitary confinement and administrative segregation, with a specific focus on prisoner and correctional officer safety. And if you do want to expand any comments on whether or not, in your experience, solitary confinement impacts or either improves or worsens an offender's chance for rehabilitation.
Well, I see solitary confinement and administrative, or what was it, former administrative segregation, as two different things. Administrative segregation, for the majority of cases in the populations across the country, was at the behest or the request of the inmates. We have what's called protective custody, and a lot of the arrangements under the administrative segregation were for a protective custody. We have inmates that can't associate with the general population, and for various reasons. It could be that they owe debts to the general population, they're fearing for their own safety, that they're put into a population where they can essentially be separated from the general population. And, during what was formerly administrative segregation, of course, they have time to recreate outside their cell. They have, time to get outside of their cell to do that. They have, meetings with healthcare every day. They have meetings with with elders, for example. They continue to take, in some cases, programming inside of the former administrative segregations. Of course, it's a more restricted environment, and for the most part, the reason for that is because we are dealing with people that are dangerous, and when we see some of the movement protocols that we need to hold inside of those segregation units, that they're for the officer safety, they're for staff safety, and they're for the inmate safety, to protect them against other inmates, protect them against themselves in some cases, and of course to protect the staff that are working in there. So again, I see segregation, administrative segregation, and solitary confinement as two things. When I think of solitary confinement, which we've never had in Canada, that in my career, I should say, you're thrown into the hole. You turn the lights off, and you get a tray thrown in at you for some food. That's not the way that things work. They have the access to telephones. They have the access to their PlayStations. They have access to TVs. They have access to everything that everybody else does. It's just that they need to be separated for their own safety or for others.
Okay, thank you. I have heard. I know that the John Howard report has said that solitary confinement has been used as a means of population control in chronically overcrowded prisons. Have you or any of your members observed that?
I'm a little unsure as to what is meant by population control, to be frank. Of course, it is a population management strategy when we're talking about segregation, for the reasons that I have indicated already, for the protection of the inmate, for the protection of others. But I'm not really sure I understand what you're meaning there, Ms. Stubbs.
Okay, I'm sure that there will be other opportunities later in the meeting for this to be expanded on. I just want to get to you quickly, because Chair, how much time do we have?
You have about 2.5 minutes or 1.5 minutes left.
Okay. Mr. Wilkins, just on the issue of the management, because this is part of the motion of the management related to COVID-19 in correctional institutions, I just wonder if you want to let people know what the experience has been like for your members, for staff, and for offenders in penitentiaries over the past year, and also if you have any comments in terms of the vaccination pilot program and the ways in which that was done for correctional officers and support staff within the institutions, as well as for offenders.
Absolutely. Well, I think I said in my opening comments in their meeting previous that it's often the Correctional Service Canada and the work that my members do is often overlooked by society. You know, people don't think about what happens once somebody goes into an institution and outside of regular society. But COVID-19 has been detrimental to the way that we have had to do business. Of course, again, in my opening comments, I said the ironic thing that stops the spread of this virus is that we isolate from one another, that we separate ourselves from our neighbors, that we don't go into public spaces, and that is exactly what happens when you're in the institution, and it goes to further isolate our inmate population, because the recreation that you could be having in the evening shifts are not available. The gymnasium is not open. Your visitors are not allowed to come. Of course, there are restrictions that are.
Well, unfortunately, we're going to have to leave it there. I apologize again. Okay, that's all right. Mr. Fisher, 6 minutes, please.
Thank you very much, Mr. Chair, and I'll stick with Mr. Wilkins as well, and welcome to the other folks that are here today to provide us their level of expertise. Mr. Wilkins, CSC has taken an awful lot of measures during COVID, and I know that unions were very much a part of a collaborative process to make decisions about sites and things like that. So this led to significantly few deaths, disturbances, outbreaks, certainly more so than some other countries experienced. What would you say has worked well, and maybe why this has worked so well?
Well, I think that Canada in general, and of course the CSE, was highly unprepared for COVID-19. Of course, when it first struck our institutions, and the first institution was in the Quebec region, Port Cartier, it spread like wildfire. And we know as soon as it gets in the institution, because of the proximity that the inmates have and the staff have with one another in those confined environments, that's what the disease thrives on. So it became very evident that in order to solve these problems, that the bargaining agents were going to need to be consulted. We're going to have to come to some agreements with how we were going to change the operations, because sometimes operations that are ingrained and routines that are ingrained in my membership, it's a hard dime to turn on. We've been doing them for years and years and years, and routine is something that's very important. So, of course, all of our focus became how is it that we keep the virus at bay, and the very first thing that we needed to do, obviously, was to close the borders to our institutions, to outside visitors, or staff that weren't essential to the workplace. And with that, I do believe that was the very first step in trying to mitigate some of the spread in our institutions. But once it gets hold, the spread happens so quickly. We have had some serious outbreaks across the country in every region except for the Atlantic region. So, not sure I answered the question there, Mr.
Which, of course, is the region I'm from, the Atlantic region. So
Me too.
You for that.
Hey.
I know. Just more generally, can you speak to some of the operational realities or challenges that correctional officers face when dealing with offenders in an SIU?
Absolutely. In the SIU, we know that there is still the reality that the mixture between inmates can't happen. They can't belong in the general population, and for some reasons they can't associate with one another. So there's a lot of analysis done to make sure that inmates that are recreating with one another can. But the operational reality is that the movement and the types of routines that that are needed in the SIU, and I say needed, it's hard to make them happen in the run of a day. So back in November, we did a survey of our membership to kind of find exactly what the problems were, and the staffing was an issue. Needing more staffing. Infrastructure was an issue in order to make the recreation happen. For example, between different populations, we need different yards, more yards, to make that type of thing happen. And of course, now the operational reality in terms of COVID has been, well, things have slowed down quite substantially, as they have across the country, across Canada. It's very difficult to have meaningful contact with the chaplains who aren't coming into the institution, for example, right?
Mr. Chair, do I have another minute?
Ooh.
Okay, so speaking, I want to talk about training that the correctional officers receive. So there's a presumption that there's lots of training. Is there up-training, retraining, modernized training on a regular basis? And maybe you can tell me a little bit about that. I had a conversation one time with a paramedic, and he said, we get retrained all the time on this, this, and this, but I've never had retraining on mental health, for instance, in the 20 years he was a paramedic. So maybe you could talk about modernizing training, up-training, retraining, and things like that.
Absolutely. Well, one of the biggest initiatives that we saw over the past few years was the Road to Mental Readiness training that came out. It was mandatory training for all staff of the CSC. It is more of a preparedness for mental health and recognizing mental health amongst staff and inmates. Coming out of COVID-19, this is going to be the biggest plague that is going to plague, I know, many departments, but CSE in particular, and that is mental health. And to be honest, I think so many more resources need to be dedicated for the mental health, not only of the inmate population, but of the staff members that are working there. What we've seen over the course of 15 months, 16 months has just been unprecedented. Our members are burnt, and they need recognition, and they need help. So the more resources that we can dedicate to training, because really there isn't ongoing yearly training for mental health. It was that Road to Mental Readiness. We do receive, suicide prevention training, which is not exactly, the in-depth analysis that we need to make when it comes to mental health, but certainly more can be done in that area.
You have about 10 seconds, Mr. Fisher.
I can't get a question and an answer in 10.
No, I doubt you can.
Thank you, Mr. Wilkins.
Madame Michaud, 6 minutes, s'il vous plaît.
Merci, Monsieur le Président. Tout d'abord, thank you, Mr. Chair, and thank you, witnesses, for being here. It's very much appreciated. I missed your opening statements because I had to be elsewhere, but I am convinced that they were very interesting. And so I will still ask questions, and I will continue with what Mr. Fisher was saying with regard to the union, Mr. Wilkins. So since the beginning of the pandemic, what I'd like to know is what the challenges have been for your members. You talked about staffing, infrastructure, space constraints. Are these challenges that still exist? Did you get support from Correctional Services Canada? Were your requests heard?
Just to be clear, Mr. Chair, I'm wondering, are we speaking directly about SIUs or just in general?
Can you clarify that?
Allez-y en général. In general is fine.
Well, I can tell you in one of the biggest things that has happened during the course of this pandemic is staffing. It's staffing crises. We've had many outbreaks across the country. I said in my opening comments that we have to date around 450, pretty close to 450 of our members who have contracted COVID-19 in the course of this pandemic. We only have a membership that reports to work for around 6,500 to 6,800, so it represents a huge percentage. And for the most part, because we are going into the workplace every single day and have been, it has been as a result of work. And of course, with contact tracing, and trying to keep the virus at bay and keep it out of the institution and keeping people at home that may have been exposed to the virus, our staffing in some cases has been reduced up to 70%. And when that happens, of course, now we're talking about people being forced to stay in the workplace after their shifts are over. Forced overtime last summer was a reality across the country. It gets to the point where our membership, in order to take some time off, they need to take a day off, but they're afraid to take a day off because they don't want somebody else to be stuck in the workplace. And it's just a constant cycle of a downward spiral when it comes to physical and mental health there. So that has been a huge reality. Of course, the genuine fear of going into the workplace, knowing that COVID-19 is there, and the thought of bringing that home to your family. We've had members who have been in the hospital because of COVID-19. The members who have gone home and infected their families from the workplace. We have had on several occasions public health measures that were specifically dictated for our membership. You're to go to work, and you're not to stop for gas on your way home from your shift. You're not to stop at the grocery store. And when you get home, you need to isolate away from your family so that you can report to work the next day. These types of things have led to, I would say, the biggest morale problem that we've ever seen in the CSE, because and I know you missed my opening comments, but there has been no recognition for that. There's been no recognition for the sacrifices that and I said, and I will use the term heroes, our members have done during the course of this pandemic.
Merci, justement. Thank you. Yes, I was wondering whether members felt safe going to work, even though they were short-staffed. Is that perhaps one of the reasons that asked them to receive a premium to recognize that they were frontline workers? And what happened with that demand? Was it heard?
We received a preliminary answer through the National Joint Council just last Tuesday that the government has done an extensive analysis on the hazard pay for federal public servants who, and the answer is no, that it will not be provided, which is just incomprehensible to me that the provinces are being subsidized to have that recognition. Colleagues in the corrections in the provinces are receiving these types of allowances. And what's really astounding is if the staffing crisis happened to the point where we didn't have correctional officers to report to the workplace, the MOU or the contingency would be to call the military in, right, to do our jobs. The military would come in to do our jobs. And when the military went into the long-term care facilities to staff them, they receive an allowance. So the ironic thing is if the military came in to do our jobs, they would receive an allowance for the jobs that we do not receive an allowance for.
That's incredible. So I imagine that your members feel that they are not being held for their true worth when such a request is rejected. My other question is whether the members would be ready to face another pandemic. Maybe not tomorrow morning, but we're still in a pandemic and challenges still exist. So I was wondering how Correctional Services Canada could provide support and improve the situation, even beyond the hazard pay and working conditions.
Unfortunately, there's no time left to answer that question, Mr. Wilkins, but I'm sure you can work it in. I believe Mr. Green is here to replace Mr. Harris. Mr. Green, you have 6 minutes.
Thank you very much, Mr. Chair. And I do appreciate the opportunity to sub in today on this very important topic, particularly as it relates to recent reports around the use of solitary confinement. And I'll share with this committee, this being my first time here, very personal connections to this. I think everybody would likely know somebody who at some point in time has been incarcerated. I myself have had many people that I know, some of which are families who have been incarcerated and have been subjected to this, what I will call cruel and unusual punishment of solitary confinement. And so if I could, I would like to begin by asking around the ways in which bias risk assessments are used in prison and perhaps have Ms. Spott share ways in which it might disproportionately affect Black and Indigenous inmates.
Professor Sprott.
With respect to the bias risk assessments, there might be someone on this panel that is better able to talk to that than I am. What we were looking at in the functioning of the SIUs is whether or not Correctional Services Canada was implementing the legislation. And we found that overall 38% of stays were qualifying by the Mandela rules as solitary confinement or torture. So that being the starting point is to try to understand why that was happening. We never received a response from Correctional Services Canada. Maybe they already knew that, so didn't think it was worthy of a response. But with the bias risk assessments, I think there's a fair bit of court challenges and findings around that in terms of security classifications. And I think that's quite well known, but I think others on the panel could probably talk to that issue more generally than I could.
I do appreciate that.
Mr. Dube, sorry, Mr. Green, I see Mr. Dube has his hand up. Do you wish to hear from him?
Yes, please. Thank you. And thank you for that response, Professor Sprott.
I think that what you might want to consider is that Black prisoners are overrepresented in the SIUs, so that they're overrepresented in Correctional Service of Canada to begin with. There are about 30% of prisoners are in CSC facilities are Black, and about close to 40% are going into the SIUs. And the problem with going back to the risk assessment issue is that what we know about risk assessment is that the validity of the risk assessment seems to vary with the group. So we know quite well that the risk assessment tools that are used by CSC do not work well for women, do not work well for Indigenous people. I have less information about whether they work as well or as badly for Blacks as they do for others. But I think that it's fair to say that in a sense, what we don't know is very important. As Professor Sprott just pointed out, the difficulty is that these things are not being looked at by Correctional Service of Canada. They are, in a sense, largely being ignored. Even the issue of the overrepresentation of Blacks in the SIUs, or for the fact that Blacks are spending more time in the SIUs, is not something which Correctional Service of Canada itself ever talks about.
Through you, Mr. Chair, to Mr. Dube, can you also provide a like analysis with Indigenous inmates, as I'm to understand that they are even more perhaps overrepresented statistically in Canada?
Well, they are certainly overrepresented in Correctional Service of Canada. I mean, they're highly represented in the institutions and in the SIUs. I think that the treatment in the SIUs between two disadvantaged groups, Blacks and Indigenous people, actually does vary. And so some of our analyses would suggest that Indigenous people are spending about the same amount of time, I believe, as the rest of the population in the SIU. Once they get there, their Indigenous people are more likely to get there in the first place. But so I think that what you have to consider is that each of these groups, in a sense, is being treated in different kinds of ways. All of them seem to be subject to the same kind of treatment, which is outside of what is contemplated by the legislation. So that we weren't able to find any groups that were being treated in the same way that the legislation would suggest they should be.
And
Mr. Green, I see Ms. Coyle has her hand up, but it's up to you.
Sure. Yes. Thank you, Mr. Chair.
Thank you for that question. I think it's a really important one. And in the prisons designated for women across the country, certainly we see, because they're multi-level prisons, so they have max, medium, and minimum security, we have what is called the max pods. And in those max pods, you see an overclassification, overrepresentation of Indigenous women and gender diverse folks. And so in these pods, you have about 3 to 5 people who are on the same ranges day after day, have very little access to the rest of the prison. And we really liken the treatment of those prisoners as the same as the treatment of those who are found in other solitary confinement-like situations. So just to bring that.
Unfortunately, Mr. Green's going to have to leave it there. Colleagues, we have 25 minutes in the next round of questioning, and we have 20 minutes before we have to move on. So I'm going to be a bit arbitrary and ask Mr. Popta, instead of doing 5 minutes, he'll do 4. And instead of Mr. Green and Madame Michaud, they do 1 each instead of 1.5. So with that, Mr. Popta, 5 minutes or 4 minutes, please.
Yeah. So yeah, thank you very much, Mr. Chair. And Dr. Duba, I was very shocked by your testimony the other day when you said that the application of our SIU operations in some cases falls within the internationally recognized categories of torture. And then you pointed out that the problem is more severe in the Pacific region than the Ontario region, for example. Now, in your evidence, you also stated, and I'm quoting from the record, I never thought that in my career as a criminologist, I would be comparing torture rates in institutions under the control of the Government of Canada. Could you expand on that, and then particularly with the comparison of the Pacific region to other parts? I'm from the Pacific, that's why I'm interested.
Yes, thank you very much for that question. What we did is we took the definitions from the Mandela rules, and we gave what we would consider to be a very conservative threshold for defining something as either solitary confinement or torture. So our numbers are probably lower than most people would have put them. And then what we did was we said, all right, how many prisoners are there in each of these regions, and what proportion of the prisoners, or what's the rate per 1,000 prisoners of this kind of treatment? And we did find, as you've already said in your question, enormous variability across regions. And so I think it's important. And I mean, remember that the terms solitary confinement and torture are in effect technical definitions drawn from the Mandela rules. So, here Jane Sprott and I are criminologists who are talking about torture rates in different regions in our country. We found that rather disturbing when we looked up to see whether anybody else had calculated torture rates in Western countries. We weren't able to find them.
Good. Well, thank you for that. Now, the structured intervention units operations or program requires meaningful human contact for a certain period of time every day. My question is whether there is any agreement about what that means, meaningful human contact, and whether the prisoners or the inmates' opinion counts for anything in coming to that definition.
Well, I think that the answer to that is fairly simple, which is that we used the definition that Correctional Service of Canada did for those activities, and it is very broad and very vague. And what we found when we did that, so we're using CSC's own assessment as to whether time out of cell was meaningful human activity. What we found was that they were not meeting the criteria that are outlined in the legislation. So, I mean, I think the question, I think, is a very important one, but it would be more important if what we had was a majority of cases where people were getting their meaningful human activity and then, or meaningful human contact. And then I think we would quite properly want to look to see what that consisted of. Our problem, the problem that Jane Sprott and I had in this, is that we're dealing with administrative data. So we're taking their story, CSC's assessment, at face value. And even taking it at face value, they're falling far short of what they're supposed to be doing. So
okay,
we don't have to get to their question.
Unfortunately, we're going to have to leave it there. Mr. Van Popte, Madame Dama, 4 minutes, please.
Thank you, Chair, and thank you to all our witnesses for all the work that you do. I would like to thank UCO and USJE for the work that you're doing in our institutions. The men and women who work in our prisons do fine work. But Mr. Wilkins, I am going to say I visited Edmonton Max. I had a tour of one of the cells. UCO was present when I visited. There were no TVs or PlayStations, and I was told that they were not even allowed books because of suicide risks. So I just want to clarify what I saw at Edmonton Max. I just finished listening to a podcast called Life Jolt about women at Grand Valley, and one of the women who had returned to prison was put in segregation because she was going through drug withdrawal. That's not the right place for people. Now, I will tell you, I worked on C-83. I was actually the one who introduced the amendment for an independent external decision maker, and I was extremely hopeful that that things would work. And Dr. Dube and Professor Sprott, I can't thank you for the work that you're doing. I do still think we can get there. But my question, switching, I only have 4 minutes, is actually for EFRI. And Emily, I wondered if you could give us recommendations around sexual violence in the prisons. It's something that you've done a report on. We know that there's a zero tolerance policy at CSC, but it's still happening. So could you perhaps tell us what we need to do, both legislatively and what the commissioner can do without legislation?
Yeah, thank you for that question. And I think certainly a zero tolerance policy is aspirational and not what is happening in practice. And I think that that goes with most of the comments about what happens in prisons, especially if you're coming from the lens of, you know, what's happening at headquarters versus what's actually happening in the prisons. And so we really have to take that into consideration when we hear from people about what's happening in the prisons, right? Who are you actually hearing from? Are you hearing from someone who thinks that this is how it's supposed to look and this is what the legislation is and these are the rules? Or how is it actually happening on the ground, practically speaking? And we hear—
So the chair's going to cut us off in a minute and a half.
Okay, I'm trying really hard to get there, but I think that that's an important piece for us to remember going into these discussions. And so first of all, I think that there needs to be, and this is really, really important when it comes to sexual violence and coercion perpetrated by staff on prisoners, there needs to be an independent public inquiry because we don't have enough information about what's happening, and we need that information. So that's one. The second thing that we can do is we can stop strip searching, which is state-sanctioned violence. We don't need it. We can stop it right now. It isn't serving its purpose at all. The third thing that I would recommend is to have access to outside mental health counseling for anyone who wants to come forward with allegations of sexual assault. They won't trust Correctional Service Canada staff. They need to have outside mental health counseling. So I think those are the three most important ones.
And Emily, can they be done by the commissioner or do we need legislation to do those? What can we act on tomorrow is, I guess, what I'm asking.
So strip searching, the legislation that exists, it has very permissive language. It says it may happen. It doesn't say that strip searches have to happen. And so that's something that can be done quite relatively easily without legislation. And that I think would be the one that I would look to. And I certainly wouldn't want it replaced with something that would be equally as invasive or
just really quickly, in 2008, there were 800 people in segregation. There's 190 now, which are still too many, but there's very few women. Mm-hmm. Do you know how many are in an SIU right now? I know the numbers are, I mean, at one point it was about 5.
It changes all the time. In fact, we were at a meeting with Correctional Service Canada about SIUs last week, and the number of people in the SIUs changed from Thursday to Friday. So I actually don't know the number at the moment.
Okay. Thank you.
Thanks.
Madame Michaud, 2 minutes, s'il vous plaît.
Merci, Monsieur le Président. Thank you, Mr. Chair. So I began with the COVID-19 situation in federal prisons because that is what was in the news this year. But there is another situation which is very disturbing, and it's part of the motion that was tabled with regard to sexual violence and coercion. And the report that was issued by the Office of the Correctional Investigator. It stated clearly that this issue is never or hardly ever addressed in public opinion, and I was wondering why that is. Mr. Wilkins from the union, perhaps, or any other witness who could answer that, and the culture of silence. If you could propose solutions. Thanks.
Well, in reviewing the correctional investigators report, they talk about inmate on inmate sexual violence, and of course, this is something that has happened throughout the history of time. When it comes to, I mean, I'm sure we have all seen memes growing up that you know, don't go to prison because you don't drop the soap in the shower type of memes. Of course, this is something that has been a reality for definitely longer than my career. I also noted in that correctional investigators report that there was one indication or one instance of reported sexual assault from a staff member in, I think it was a span of 4 or 5 years of reported. So I don't want, certainly, you know, we certainly do not condone any type of sexual abuse or coercion from any staff member towards an inmate. But the focus really here is how it is that you can put a stop to this inside of the institutions. And
okay. I feel badly, Mr. Wilkins. I keep cutting you off, but I have no choice. Sorry about that. Mr. Green, you have 2 minutes.
Thank you, Mr. Chair. Under the basic principles, rules 1 and 2 of the Mandela Rules, it talks about how all prisoners shall be treated with respect to the inherent dignity and value as human beings. And rule 2 is that the present rule shall be applied impartially, and there shall be no discrimination on the grounds of race, color, sex, language, religion, et cetera, et cetera. And yet in the testimony, Mr. Dube expressed that Black inmates are subjected to this cruel and unusual punishment, this torture of solitary confinement for longer periods of time. So if I can get one thing out of this committee through you, Mr. Chair, to Mr. Dube, what remedy would he have to help dismantle the inherent anti-Black racism within this regime?
I don't have a simple answer to that question. And the problem is that what we're dealing with is a description of what CSC has given us. So we can identify the problem, and I don't have simple solutions to suggest to you. I think that the first thing that needs to be done on all of these matters is that CSC has to acknowledge the fact that they're there and work toward changing it. But I do have some suggestions.
If I could, with specificity, to acknowledge the inherent anti-Black racism in the extended period of time for detainment, is that what we're putting?
I think that they at least have to acknowledge, whether they acknowledge it as such or whether they acknowledge the fact that the lengths of time do vary, is at least a start. At the moment, remember, what we don't even have is an acknowledgement that there are any problems whatsoever that are not caused by prisoners in the SIUs. So I think it's important that we start by acknowledging what the problems are. I do have some suggestions on where they might start, and that is that the variation that we see across institutions is a good place to start, because it's not as if there are any institutions which are wonderful, but there are institutions which are much worse than others. So that if we could find that some institutions are doing things better, maybe we could learn from those differences and move on. But I honestly, I mean, remember what we're looking for. We're sitting, Jane Sprott and I are sitting in separate offices in Toronto, working with CSC administrative data. And what I would have hoped, had there been proper oversight of the SIUs, what I would have hoped is that a panel like the one that I unsuccessfully chaired, or that I chaired and was unsuccessful.
I too am unsuccessfully chairing a committee.
Chair, just a quick point of order, Mr. Chair. Could I make the request that he provide the remainder of his statements in writing to the committee for our consideration at a later time?
Absolutely.
Thank you.
Yeah, I apologize to everyone. I see Ms. Latimer's anxious to answer a question here, but I'm going to have to move on and go to Mr. Motz for 4 minutes.
Thank you, Chair. I'm actually going to defer to my colleague, Mr. Carrick, please.
Damien.
Thank you very much, Mr. Chair, and thank you to the witnesses for joining us here today. Mr. Wilkins, I'm proud to represent a large region of East Central Alberta, which includes the Drumheller Institution, and I've certainly worked with and heard from many correctional officers, including some of the challenges related to COVID. And I guess my question specifically about vaccines and some of the concerns that I've heard is at any point did the government's did Correctional Service of Canada consult with the UCCO about their vaccination strategy?
Absolutely. After they announced that they would be procuring vaccines for staff members in the institution, but UCOSAC CSN has been calling ever since the beginning of the pandemic that once a vaccine was available, that it should be offered both in the institution for the staff and the inmates because of our close quarter working environments and the fact that we're a communal living facility, and that we can't see, when we put the onus into the provinces, a difference between each region as to who's going to get vaccinated first. And our members are performing the first responder group of all occupations. We're firefighters, we're paramedics, we're police inside the institution. We're often very close quarters with inmates and with each other. And it was very important to us that our members were given priority. So we engaged on many fronts about being a priority. Finally, now we were consulted once it was procured for the institution and staff.
Thanks for that. I think that one of the frustrations that I certainly heard from correctional service officers, members of the UCCO, is that they were in the precarious position of having to assist with the administration of vaccines to inmates, and saw nurses and other healthcare professionals that had received theirs, but they were not prioritized in the same way. Is that an accurate perception from your point of view?
Absolutely, because the initial vaccine rollout was conducted by each of the provinces, and the provinces made their determinations based on the National Association of Infectious Disease, the NACI guidelines, and it was different. Of course, rightfully so, healthcare providers need to be given priority, but we're also providing healthcare in the institutions. So it was very confusing to us as to why we weren't listed under that communal living and priority number one in the provinces. But of course, with the influx of vaccines now, there has been vaccines in the institutions. So.
Yeah, the final surplus, although I would suggest much delayed, has certainly alleviated a lot of these challenges. But I know that again, speaking to correctional services members, there was a great deal of frustration, both from the work that they were doing within the institution, and also the perception of how things were being managed at the institution from the community. And in many cases, you have officers that live in or nearby. They told me, in fact, one, I'm paraphrasing, but basically said the public information coming out of the institution is false. They're lying to us, is the words that I heard. Now that's specific to an institution that I represent. I've spoken to a number of colleagues that likewise represent other institutions, but I was concerned to hear.
Mr. Girk, you're unfortunately well past your time.
Okay.
Sorry about that. You gotta love this job. 4 minutes, Mr. Lightbound.
It's actually me taking it, Chair.
Oh, are you? Okay.
Yes, I
Madame
am.
Dema.
Thank you. You know, one of the things that I found really frustrating as COVID first hit was that inmates in the institutions were being vaccinated by the federal government. But those who work there, it was actually provincial decisions. And it's unfortunate that the province has made the decision not to prioritize those who work in the institutions. I think it was frustrating for all of us that Mr. Wilkins, you and all the others who work there weren't prioritized by the province. I have a question for Dr. Dube. Have you actually had an opportunity to visit an SIU? And if so, what were, I mean, COVID has obviously put restrictions on it. It was something that I had hoped to do and haven't been able to do it. But I'm wondering if you have had an opportunity to visit them in person. You're on mute.
You're mute.
The simple answer to that question is no, I haven't. And part of it was that I took seriously the plan that the panel that I chaired had in place. And that was we were going to be looking at the data on the early days of the operation of the SIUs in early 20. Our plan was to look at it in early 2020. Correctional Service of Canada was supposed to be giving us data in February of 2020. And then what we would do is learn from those administrative data on what the questions were that we should be looking at within the institutions. Because we as a panel always felt that the administrative data that Jane Sprott and I have been working on for the last 10 months or so was the starting point, not the end point, and the starting point so that we would go into the institutions and actually know what to look for and what we should be questioning people about. And so we had two problems. One, obviously, is the COVID problem. The second problem is that we were delayed many, many months by Correctional Service of Canada's decision not to give us data until they were pressured to do so by the minister in late summer of 2020.
And you're on mute.
I see Ms. Latimer has her hand up, but just before we go there, I know one of the concerns we heard that inmates don't necessarily want to leave their SIU. And one of the flags I had when we looked at S80 or C83 was, well, then that indicates a problem that needs to be reviewed because there's a reason why they're not wanting to leave, whether it's safety, whether it's mental health, whatever the reasons are. So it doesn't indicate that it's right that they're not wanting to leave, and it may very well be true. But we need to get to the bottom of what the reason is for them not wanting to go. You've only got about a minute, Catherine. You're on mute.
Mute.
I will just say that I did have an opportunity to visit the structured intervention units in January. So they had been up and running for a couple of months anyway, and they were pretty disorganized. I went to the one at Millhaven, and I'm happy to send you my notes. I'll send those.
That was
to
in
the
January
clerk
2020. So that was right after they'd been implemented though, right?
Right. Yeah. But I'd be happy to send them to you. You can see my initial observations.
Maybe you could send it to the whole committee.
Sure,
that would
be happy to do that.
That would be great.
Okay.
Thank you.
I would
Chair.
really rather you left it there.
Yeah, I'll leave it there. I'll leave
you.
it there.
Thank you. It's 4:32, and we have the commissioner up next, and we have a hard stop at 5:30. I want to thank the witnesses and thank the witnesses over and over again for your patience coming back. And this is an extremely important subject. So again, thank you. With that, we'll suspend while we empanel the commissioner. We have Madame Kelly, the Commissioner of CSC, and we are under the gun. So I'm just going to ask you to make your 7-minute statement, and unfortunately, I'll have to cut you off when we have to leave. So with that, Madame Kelly.
Okay. Merci.
Thank you. Mr. Chair and members of the committee, I would like to thank you for the opportunity to appear before you today. I would like to begin by highlighting that today is the National Indigenous Peoples Day, and I would like to take this opportunity to celebrate the contributions and rich culture of Indigenous peoples, including those of numerous Indigenous employees who play an essential role in inmate rehabilitation.
I want to offer thanks to CSC staff for their tireless and dedicated efforts and recognize the ongoing collaboration of offenders in helping us manage the pandemic. I'm pleased to report that we currently have 0 active COVID-19 inmate cases across the country. Before speaking about our vaccination program, I want to highlight what has worked in getting to that result. Notre partenariat avec les experts en santé publique.
Our partnership with our public health experts, our unions, and our stakeholders, including the Red Cross, completing infection prevention and control reviews at all of our 43 sites, developing an integrated risk management framework with the help of our public health partners, unions, and stakeholders, developing a comprehensive testing strategy at the beginning of the pandemic, as well as rapid screening. We have screened over 250,000 tests. And we have been undertaking contact tracing as well. We have communicated weekly with staff and inmates and stakeholders to keep them informed about the COVID situation. We have Corcan that is quickly pivoting to produce over 850,000 masks.
Provide light at the end of this long tunnel. As of June 17th, over 75% of the inmate population has received at least one dose, and 42% are fully vaccinated. We continue to run clinics and engage with inmates who have declined to understand their concerns and work to address them. Managing COVID, although not easy on anyone, has truly been a team effort. We are currently starting to plan for when we can safely resume activities and lift restrictions. This will continue to be a collaborative effort with public health and what the data is telling us. I would now like to turn to structured intervention units, or SIUs. As you know, SIUs were implemented on November 30th, 2019, and represented a transformative change for CSC. Although COVID-19 has created unique challenges for everything we do, including SIUs, I'm extremely committed to their successful operation. SIUs are not about punishment or causing harm, quite the opposite. SIUs are meant as a temporary measure and are about helping inmates by providing them with the opportunity to engage in targeted interventions and programs to support their safe return to a mainstream inmate population as soon as possible. There are currently 186 inmates in SIUs, which roughly represents 1.5% of federal inmates in Canada. And I should point, there are 33 Indigenous inmates, so 17%. This is in contrast to the former model where close to 800 inmates, or over 5%, were in administrative segregation in 2009-2010. This points to a shift in mindset whereby SIUs are being used as a last resort, with more being done proactively to manage situations within the mainstream population. And this 1.5% needs to be put in context. Inmates in SIUs present a profile that clearly distinguishes them from the mainstream population. Recent analysis shows they are more impulsive, have low frustration tolerance, frequently act in an aggressive manner, and are 14% more likely to hold attitudes that support goal-oriented violence. Des UIS sont en place dans 15 de nos...
There are SIUs in 15 of our 43 institutions, and an offender can only be transferred into an SIU if they meet the 3 criteria in the Act and if there is no other reasonable solution for the inmate. Before transferring an inmate to an SIU, all of the other possible solutions are examined, such as mitigation or conflict resolution, transfer to another unit or another row in the institution, and the participation of the inmate committee or the staff who has influence on the inmate, an elder or a volunteer.
Is not a one-size-fits-all approach. We deal with some difficult and complex situations. For example, we have over 250 separate gangs in our institutions, which makes it a challenge to find a safe space for some inmates. While some cases can resolve quickly, others take time and require ongoing care and steady work. The law is clear. Inmates that are transferred to an SIU must be provided with the opportunity to spend a minimum of 4 hours a day outside their cell, including 2 hours of meaningful interaction. The legislation recognizes that there are situations with an inmate may be held in their cell for longer. For example, if they refuse to leave. While it is their right, we continue to make active offers. A key safeguard...
Excuse me, sorry, Commissioner Kelly, I apologize. That's all I do in this committee. I have the permission of members to suspend, to continue until 5 minutes before the vote. It's just under 5 minutes now. If I could get the guidance of the clerk as to whether we have one vote or two coming up.
There's
Two?
a vote. There's a vote on
Okay.
report. It's votes on report stage of C30, so I believe there are two.
So there's no chance that we can come back and hear the rest of the commissioner's statement. So
Can we come back for the in-camera portion, Chair? I think we can.
well, we have a hard stop at 5:30.
I don't think we do.
Correct me, clerk. Can I come back for that?
The information I've been given is that it's a 5:30 hard stop.
So I'm being told that if because other committees didn't meet this afternoon, that we might be able to extend it, Chair. And I know we have to go to vote. So
Okay. If there is right now, the meeting will be adjourned. And unfortunately, I will call a meeting for next Wednesday, regardless. And to table both the Levesque report and the Bastarache reports tomorrow. If we can come back and we do have time, we can do it. The clerk will send it a notice. So with that.
Sorry, yes. Mr. Clerk, did you say Wednesday or next Wednesday? Just
Wednesday.
So that we're clear.
Next Wednesday.
Okay.
2 days. Yeah. Okay. I apologize again, Madam Commissioner. You can appreciate more than most. We are in difficult circumstances. So I think I could. No, I don't. I can't suspend. I'd have to adjourn. And if there's an in-camera portion, we'll call another meeting. So with that, we're done. Thank you again. I apologize. Okay.
sorry, Commissioner.
you.